Welcome back, everybody. Now I'm going to explain how easy this is to understand. This is one heartbeat. Now when you look at strips, this is your isoelectric line. That's the line that connects everything. That is the absolute resting phase of the heart. These things are meant to go flatline, bump, flatline, bump, flatline, bump, flatline, bump, flatline. These are not meant to bump into each other. Now, each little bump was assigned in alphabetical order, and for some strange reason, they picked the middle of the alphabet. So that's our P wave. That's our QRS complex. It is complex, there's 3 parts to it. That's our T wave, and that's our U wave. I'm going to break this down, but right from the beginning, I'm going to eliminate a U wave. You'll only see U waves when your patients are very bradycardic, heart rate's less than 50. Not every bradycardic patient will have a U wave. The slower their heart rate goes, the larger the U wave will become. So U waves are really created by electrolytes we commonly replace, like potassium, magnesium, calcium. Someone with a slow thyroid would have a U wave. Certain medications will give you a U wave. Not all of your patients will have a U wave, and having one doesn't make them healthier or sicker. It's just an indication, but you'll only see them when they're bradycardic with heart rates less than 50, and the slower the heart rate, the larger the U wave becomes. So you won't see this in all your patients. In almost all your patients, you're going to see the P, QRS, and the T. So the P wave is not very impressive on paper because it's not very impressive of a contraction. This is when your atriums contract together, 15 to 30% of cardiac output. You can't even feel a P wave. You can only hear it with your stethoscope. Now the QRS is huge because it's a huge contraction. That's when the ventricles contract together. This is the palpable pulse. And the T wave is the resting phase. So one heartbeat, the atriums contract together, the ventricles contract together, and the heart can rest. So when you put it into practice, when you feel and count your patient's pulse, you're feeling and counting the QRS complex.